Welcome to Nostalgic Medicine, a look back at the history of medicine and healthcare. Today's video is on the history of depression. Mental illnesses like depression have gained a massive amount of awareness over the past few years, and that's a good thing. Up to 20% of people will develop depression sometime during their life. And I can't stress enough just how important it is that they get full access to the valuable treatment that is currently available. We all probably know someone who is currently depressed, or have ourselves been affected by it. But what exactly is depression? Well, if you look into a dictionary, depression is defined as a persistent state of unhappiness and pessimism, which is a decent definition. But doctors like to quantify depression by using diagnostic systems such as the DSM, which lists a number of different symptoms that are required to make a diagnosis of depression, such as low mood, a lack of enjoyment, and low energy. These systems allow us to accurately measure just how severe the depression is, which can then guide how intensely we need to treat it. But of course, people have been depressed since the beginning of human civilization, but the DSM was only created in 1952. So how was depression viewed by people in the past? Well, if we look back to medical texts from ancient civilizations in places like Mesopotamia, you'll find many cases of people suffering from mental illnesses that were written about. But they were mostly poorly defined, and there wasn't any specific clinical conditions attached to them. Most people back then believed that things like depression were caused by evil spirits or gods, so they mainly tackled their illness in a spiritual way by going to religious figures. But the one medical management that was used sometimes was trepanation, as people believed that drilling holes in your head could get rid of the evil spirits. The first time that depression was properly described by a doctor was during the time of the Greek physician Hippocrates in the 5th century BC. He based his entire understanding of the human body on the system of the four humours, and he was quite forward thinking, because he thought of mental disorders in the same way as he thought of physical conditions. What we think of depression nowadays was most similar to a condition that Hippocrates called melancholia, which was caused by an excess of the black bile humour and leads to depressive symptoms such as loss of appetite, low mood, and sleeplessness. Now, even though many of the symptoms that Hippocrates mentioned are also seen in the DSM criteria for depression, melancholia wasn't exactly the same thing as what we today know as depression, because he also included non-depression symptoms like anxiety, delusions, and delirium within this umbrella term of melancholia. And as was standard for Western medicine at the time, to treat melancholia, you needed to achieve a balance in the four humours by things like diet and exercise. This belief in melancholia persisted for over 2,000 years after the life of Hippocrates, meaning that there was hardly any new scientific knowledge about mental illness that was discovered during this time. The most extensive overview of melancholia was from a book called The Anatomy of Melancholy, which was written in 1621 by a priest called Robert Burton. He goes through the many different types of melancholia in this book, the things that causes them, and lists several different cures for melancholia, ranging from exercise and sleep hygiene to music and religion. By the time humoral theory fell out of favour in the medical world, there were up to 30 different types of melancholia that were described. But from about the 18th century onwards, doctors instead started to see medical conditions as being caused by damage or pathology to specific organs and tissues, and decided that these conditions needed to be sorted into well-defined categories based on their pathology. and mental disorders would eventually be classified as well, as they were considered to be caused by pathology to the brain and the nerves, known as psychoses and neuroses respectively. The most influential classification system in psychiatry was devised by the German psychiatrist Emil Kraepelin in 1898, who divided all forms of psychoses into two main categories. The first category was dementia praecox, which is now known as schizophrenia, and the second category was called manic depressive disorder, which was later divided into bipolar disorder and depression. By doing this, Kraepelin implied that the two categories of psychoses had two distinct pathological processes, and created a system which gave inspiration to the original DSM, and still remains influential to this day. This also meant that depression was now as much of a medical condition as diabetes or measles, as it had objective defining criteria for diagnosis, and could therefore be treated by a medical intervention like drugs or surgery. This would lead to people trying to treat severe depression using many incredibly invasive interventions in the early 20th century, such as lobotomy, insulin shock therapy, and electroconvulsive therapy. I won't get into too much detail about these treatments, as some of them deserve a video of their own, but a lot of them did more harm than good, and patients with depression often came out of these treatments as a shadow of their former self. But fortunately, around the same time that these invasive treatments were being used, a completely separate movement in the treatment of depression began to develop, which was led by Sigmund Freud, the world-famous psychiatrist. Instead of assuming that there was an underlying brain pathology in depressed people, his new movement theorized that depression was caused by an abnormal emotional response to things like the death of a loved one or the failure to achieve a goal. Freud's psychoanalytic method of treating depression was by encouraging a patient to talk about their life's problems and then become aware of the things that might have led them to become depressed. This method seemed to work for many people, leading Sigmund Freud to become a household name. His work would inspire other psychiatrists to develop several new forms of psychotherapy, and some of them, like cognitive behavior therapy, remain the mainstay of treating depression to this day. But even though previous invasive treatments failed, the pathological theory of depression would regain momentum in the 1950s. The main reason for this was that when clinical trials were being conducted on drugs to treat tuberculosis like isoniazid, the researchers found that these drugs significantly reduced the symptoms of depression in the patients they gave it to. Further analysis of these drugs would show that they were very effective in preventing the breakdown of neurotransmitters, such as serotonin, dopamine, and noradrenaline. This gave rise to the chemical imbalance theory of depression, which hypothesized that depression was caused by a reduction in the levels of several key neurotransmitters that are important in the regulation of mood, reward, and behavior. This then led to the introduction of imipramine in 1957, the first drug to be officially marketed as an antidepressant, as it had the ability to increase the brain activity of serotonin and noradrenaline. But the antidepressant drugs belonging to the same group as imipramine had many side effects, and were incredibly dangerous if overdosed, so they were eventually superseded in the 1980s by another similar class of drugs called SSRIs, which are relatively safer. SSRIs are now among the most prescribed drugs in the entirety of medicine, and the producers of these drugs generate billions of dollars a year in revenue. Now, even though the chemical imbalance theory of depression still remains controversial, and many people doubt that antidepressants even work, scientific studies have proven time and time again that they are effective in treating depression compared to placebo, especially when the level of depression is moderate or severe. They actually seem to be objectively better at what they do than many other drugs that we commonly prescribe in medicine, like the drugs we use to prevent heart attacks, treat hypertension, or prevent the complications of diabetes. So despite the widespread criticism of antidepressants, they have no doubt been a significant step forward in the history of treating depression. There still is a very long way to go with medicine and society's battle with depression. People with depression are over 3 times more likely to commit suicide than other people, and beyond just mental health, there's also a strong association between depression and chronic conditions like heart, lung, and liver disease, which also significantly reduces life expectancy. But we can look forward to the future, as new drugs that might help more people with depression are in the process of being approved. We've also discovered many other unconventional methods of treating depression which seem to help as well. Even the previously denounced electroconvulsive therapy can be helpful in specific cases. And lastly, as more people have access to vital therapies like CBT, and the stigma of having depression is reducing, people who have the condition can finally feel like they are being supported through it.